Once again, good evening, everyone. We're going to start now. First, let me thank the administration and staff of Denzel Washington School of the Arts for allowing us to be here tonight and to share in what I believe is an important community conversation. It is a community conversation that has been going on for a few years now, since we first were alerted that Monty had plans on closing Mount Vernon Hospital. And it was from that moment that this community has rallied to save and to transform the hospital. All throughout this pandemic, many people in our community who had high COVID rates and those type of things who needed a hospital, many of them were transferred to other places for care in the middle of a pandemic. While the governor at the time was using the Javits Center and sending in the Mercy ship for COVID patients, we had a perfectly good hospital that had beds available, which were not utilized at all. All in what I believe it was a plan to say that our hospital was underutilized and nobody went to our hospital. It's from that moment that Monty has not done much of anything to make sure that we have quality health care in the city of Mount Vernon. I'm a true believer that Mount Vernon is definitely a city on the rise. We are one of the greatest cities in the state of New York, but we cannot be as great as we could be if we don't have quality health care. And I know many people say, we can go over here, we can go there, we have Lawrence, we have other hospitals, but Mount Vernon deserves a hospital, and we deserve a hospital that has quality care. Even right now, if you ask Monty, they'll say that the ICU unit is open at Mount Vernon Hospital, but the truth of the matter is that that has no intensivists. So those who are severely ill that need ICU will be transferred to other hospitals. You'll hear later from some of our nurses of some of the transfer rates of those coming into our hospitals who have to be transferred to other hospitals. But if we had quality health care and we had systems in place in Mount Vernon, people would not have to go to other places and over other locations to receive quality health care. All of us have heard of the horrific murder of that 16-year-old here in the city of Mount Vernon. And maybe if we had a trauma unit, maybe if we had a place where she can come right here, that we won't have to transfer our people to Jacoby and other places to get quality health care. So we come tonight to have this community conversation, to make sure we get our community back engaged. If we really want to save and transform Mount Vernon Hospital, our community is going to have to get involved. We're going to have to get involved. I heard people say, well, I don't use that hospital. You never know what hospital you're going to use when you're unconscious. I want somebody to take me to the closest place that is going to save my life. And so we want to be able to come together. And so we're going to share some slides at this moment and see if I can do this. There it goes. As you know, COVID-19 has exposed long-standing racial disparities when it comes to health care. We were able to see in the midst of all of this systematic racism that happened, that hospitals in communities of color received less care. We'll find out that they did not receive less money, but less money went into that particular hospital. We found that even during COVID, when hospitals were receiving records amount of money from the federal government, some came to Mount Vernon, but not as much as it should have. Why? Because we were transferring patients out. So the only way to begin to find solutions to how systematic racism plays out in our healthcare is to examine the actions of healthcare providers, healthcare policy decision makers, in either reinforcing or dismantling the inequities that exist in our healthcare system. There is no doubt that there are inequities in our healthcare system, and we need to dismantle them and demand that we have quality health care here in the city of Mount Vernon. Although receiving large amounts of public funding from state and federal taxpayers, it is not directed, Monty has not directed these dollars to improve health care outcomes in the communities most needed, and most of them have been communities of color. So we need to make sure that those dollars, our taxpayer dollars, go to help and to save and to transform Mount Vernon Hospital. DSH funds, which is Disappointed Share Hospital funds, are under attack at the federal level, and New York State must stop subsidizing profitable hospital systems that do not meet the need of the community. We're not saying don't fund hospitals. We're saying don't fund hospitals that won't meet the needs of the community. If you don't have the necessary programs and the necessary tools in a hospital, why continue to fund it? If we can't, if one of us had to go into critical care right now, we would not be going to Mount Vernon Hospital. Not because they don't have quality doctors, not because they don't have quality nurses, but they don't have the system set up to make sure that we would get the quality care that we need. New York State distributes a total of $3.6 billion in DSH funds, including a subset of $1.1 billion called the Indigent Care Pool. Those current ICP methodologies only distributed 85% of the funds based on actual care provided to uninsured patients and Medicare enrollees. In other words, this pool of fund goes to help bridge the gap of Medicaid and Medicare and those who come to the hospital with that. But the 15% of the remaining funds, that's $140 million, is spent under the transition collar, which was intended to limit the hospital's exposure to loss. So that means the hospital has another $140 million to play with. And so they bridge the gap, but they have other money. So the Affordable Care Act reduces the DSH payments nationally based on the idea that the uninsured would be eligible for ACA insurance, but New York State has a large number of uninsured individuals, immigrants who don't qualify for insurance and people who can't afford coverage, as an example. Without a change to the current state law, New York City Health and hospitals will bear the initial brunt of any federal DHS cuts. So it means there'll be cuts. So if there's cuts, which hospitals do you think they're going to cut first? The ones that they don't fund well in the beginning. And so, and you can best believe that Monty is not happy with Mount Vernon. They're not happy with Mount Vernon because they wanted to give us an emergency room and we wanted a hospital. And with the help of our mayor and others, that project was shut down. And so that project was shut down. And so you know they're not happy. So Monty sings the same song they've been singing. The hospital's not closed, the hospital's not closed, the hospital's not closed. But when it doesn't have services, it's like it's closed. So what you'll see is, in this next slide, the community and its health. Mount Vernon's household income is $59 or $59,000 with a poverty rate of 14%, but we only have 7.2% uninsured people. Well, if you look at New Rochelle, they have 11% uninsured people, and if you look at White Plains, they have a higher household income, but 11.3% of their community is uninsured. Meaning, when Monty says, well, Mount Vernon has a high number of Medicaid and Medicare patients, well, we have more people who have private insurance that can be charged to the hospital versus other hospitals that you'll see in a minute that they pour more money into. So there's a large disparity in income and races across the many communities that comprise Westchester. The poverty level in Westchester County is around 8.4%. In the north, poverty levels as low as 3%. Only 2 cities in Westchester have a poverty level over 13%, Yonkers and Mount Vernon, and that poverty level is 14%, almost double that of the county as a whole, but we still get the smaller piece of the hospital money. Mount Vernon median household is only 60% of that is Westchester as a whole. Mount Vernon is also the seat of Black Westchester with an African-American population of 66%. So what does that look like? A hospitalization rate, if you look at Monty and White Plains versus Mount Vernon Hospital, you see 1.57 persons per 100 hospitalized, while there's even more in Mount Vernon, 2.35 people per 100 are hospitalized in Mount Vernon, where White Plains has a death rate of 17%, while Mount Vernon has a death rate of 28.4%. And when you look at that, you'll see that we still get the lower piece of the pie when it comes to the funds. You put more funds in the hospital, you have more services. You have more services, more people can receive quality health care. And this next slide, I don't know if we can blow it up, but what you'll see is the tale of 2 ICUs. In these tales of 2 ICUs, you'll see the demographics. We have an ER wait time of about 7 hours in Mount Vernon versus 5 in White Plains. You have about a 7 hours wait time to be admitted in White Plains, while you have 9-hour wait time to be admitted into Mount Vernon or the hospital that they send you to. Because many times they're going to transfer you out. In inpatient care, you can get admitted to ICU in White Plains. You cannot do that here in Mount Vernon. Patients are transferred to New Rochelle in the Bronx, travel time between 14 and 30 minutes to get somebody who needs care, the care that they need. You'll see waited to be admitted after that 12 hours. Somebody is in extreme care or extreme need of care, and they're waiting 12 hours to be admitted from the time they're told that they need to be transferred. The coalition have heard many stories of patients who have begged not to be transferred out. No, don't transfer me. Admit me here in Mount Vernon so my family can come visit me, so that I can do what I need to do here around people that I'm familiar with. Once you transfer somebody to New Rochelle or to the Bronx who does not have transportation, so when you send them in an EMS or however you send them, how are they getting home when they have no transportation and they're low on funds? But they should be able to be admitted here in our hospital. But Monte doesn't stop there. They continue to expand rapidly in the Hudson Valley with pending acquisitions of other hospitals, St. John's, Riverside, and Yonkers, another medically underserved community. So Monte has this system of acquiring underserved hospitals and underserved communities and then taking even more services out. Many of you remember when Monte came and took over, they promised us everything. They promised us restored services. They promised us more services. But really what we got is paint and new light bulbs and nothing more than that. So there must be a greater examination of the hospital systems. We need our New York State Department of Health to look at some of these issues and to come in and help us to continue to save and transform our hospital. This is a great time to ask all of those who are running for office, what are they going to do about Mount Vernon Hospital? Right now, guns are a hot button topic, which they should be. We need to get rid of the guns off our street. But at the same time, we need to make sure we have quality health care. What happens is that our young people need to know that if they get sick, they can go to the hospital. What happens in our community when we have young people with type 1 diabetes and don't have endocrinology here at Mount Vernon Hospital? How do they get the care that they need? How do we make sure that their diabetes are managed and that they are doing well? So, while hospitals all over the state are shut down, revenue-generating procedures and admissions, the COVID crisis, many of them were made whole by relief funds distributed by the CARES Act, including high-impact funding, paycheck protection programs, all of those things. Hospitals were afforded an opportunity to apply for those funds, and yes, Monte did apply. While Mount Vernon and New Rochelle received $21 million and $47 million respectively, White Plains received more than $87 million from that program, more than double that of New Rochelle and Mount Vernon. As you know, you cannot have a baby in Mount Vernon. And for a while there, Monte closed the maternity ward in New Rochelle, so you had to either go to Yonkers or the Bronx, and that's even further away for our citizens. White Plains was essentially rewarded for having higher paying, privately insured patients and lower death rates than Mount Vernon because people got transferred there. And while Monte could choose to redistribute CARE Act and PPP money to Mount Vernon, it has not done so. Private healthcare corporations such as Monte seek to maximize their profitability, often leaving behind the very patients that need to be served and reinforcing existing healthcare disparities. In other words, Monte has had a system of putting profits over patients, and we need to be able to stop that. What you see here is now some of the funds that came in 2020, Public Cares Act and PPP funding. White Plains, $85.8 million. Mount Vernon received $21.5 million. New Rochelle, $47 million. In 2019 through 2020, Monte invested to expand or improve services in hospitals. You can see what they spent to expand or improve services. $272 million they put in White Plains Hospital, and zero for Mount Vernon, all the while saying the hospital was not closed, all the while saying that the Mount Vernon Hospital is still open. Well, it doesn't look too open if you're not going to put funds. Not even $1 went to approving the hospital. And so that really ends our PowerPoint slide right now, but I wanted you to see how important it is for us to continue to have these community conversations. Mount Vernon, we're taxpayers. The money that we're asking to put in the hospital is our money coming back to the city, our money coming to make sure that we can have quality health care in every possible way. And so I wanted to show you that, so this would kick off our conversation tonight as we begin to look at what is needed to help and save Mount Vernon Hospital. Any questions? I'll take questions at this point, then I'll move on to a couple of, some of our nurses are still at work. They'll be here a little later. But I'm going to ask, okay. Thank you. I'm going to ask that Jesse Van Loo would come now. I think I saw him coming. Yes, I did. He come and share with us at this point.
I'd like to thank Pastor Pogue and our elected officials and city council members for attending. I'm pretty sure I'm here for the right reasons. Everybody else is here to get full service at Mount Vernon Hospital. A little story to tell. 2014, had a minor heart attack. Went to Mount Vernon Hospital, no services. My wife drove me in the car to Lawrence. And first thing the nurses told me, I should have never did that. You took a chance getting here. So what I'm asking too, around the clock, I have an unconventional way of delivering my messages, which I will continue to do. I call it shake the tree. But what it is, we all have to stand together. Taxpayers, like Pastor Polk said, get the full service we need. We have a lot of trauma patients in Mount Vernon, with the gunshots. I'm fighting that. And it's imperative that we take them straight to Mount Vernon Hospital, not to Jacoby. That 10-minute, 11-minute ride is unacceptable. You got 2 minutes. Most likely get to Mount Vernon Hospital. It's about saving our lives. It's about change. I will continue to help and fight and stand with everybody. I applaud everybody that's in here right now because I didn't think I would see that many people here, but it should be a lot more. So what I'm going to say is, J.C. Van Loo, concerned citizen, co-founder of Save Mount Vernon, I stand with you. I'm here with you. I will still continue to fight with you. Thank you.
Thank you. And it's so important. Mount Vernon should have a trauma unit. If we had a trauma unit, it would not only help our residents, but it helps surrounding residents, that residents in other community can get the life-saving care that they need in that moment of trauma. At this time, I'm going to ask Judy Sheridan Gonzalez to come. She's an RN in Monte de Bronx and former president of the New York State Nurses Association. You come here, there, you can go either way you want to go. Good to see you again.
Thank you, Pastor Polk, for having me, and thank you, everybody, for coming out. This has been, what, a 3-year struggle now? 4-year struggle? I can't even remember how long. I think it's really important, though, to remember, a lot of times people give up. They think that they say you can't fight City Hall. City Hall here is not what we're talking about. But people think they can't win when they fight. Let's be clear. Montefiore planned to close Mount Vernon Hospital. That was the plan. It was signed, sealed, and delivered. They built something up north. They were going to put some kind of freestanding, some sort of center up there. They had construction going. They had put the plans in. This community and the staff in Mount Vernon Hospital and the surrounding Montefiore hospitals systems that were sympathetic to this situation, because many of us face the same issues in the Bronx, stopped that from happening. So this community should really be proud of itself. We say when we fight, we win, but I like to say when we fight, we have the right to win, because if we don't fight, we always lose. So I think that that's a really big victory. The fact that the hospital remains open is a really big victory. I noticed yesterday they circulated something. They found out we were having this town hall today, and all of a sudden yesterday they're having a job fair. I don't know if you saw that, Pastor.
I did. I laughed.
The big job fair, coincidentally the day before the town hall, because this is how Monty functions. I'm an emergency room nurse in the Bronx. I've worked at Montefiore Emergency Room on Gun Hill Road for 40 years. I live in the neighborhood. Yeah, I'm still alive. Through COVID, we had the highest COVID rates. This region had the highest COVID rates and deaths in the world in 2020. And we survived, and we took care of our patients with very little resources, with no masks, and that was another fight to get all the things that we needed. We could have done so much more if Mount Vernon had remained open. We had sick patients, ICU classified patients in Mount Vernon that could not be cared for here, and our ICUs were overflowing. Everyone saw the news. We had no room in our ICUs. I don't know how many people might have lived had Montefiore behaved more responsibly at that time. We still have to hold their feet to the fire. Everything the pastor said is true. They take all these resources. I call them poverty pimps. They get money for the poor, and they give it to the rich. They have rebuilt the ERs in White Plains Hospital. They put money into Nyack Hospital. But in our hospitals, in Montefiore, where I work on Gun Hill Road, we have 30 to 60 patients in the ER waiting for beds. They closed a unit in Montefiore, a full 30-bed patient unit, and now they're putting people in the hallway. And here at Mount Vernon, there are empty beds. We get transfers all the time from Mount Vernon, and it's very dangerous to transfer very sick people. So people are being put in jeopardy. I'm sure lives are being lost. People are having bad outcomes because of these really ill-founded decisions. They're money-making decisions. Profit has no place in healthcare. Everybody should have the right to healthcare. And those of us who deliver healthcare have seen our own profession and our practice eviscerated by this system that is very cutthroat and geared toward money-making. The other thing that I think that people probably are aware of is this is very valuable real estate, Mount Vernon. And one of the ways that you gentrify an area, because I live in the Bronx where they're trying to do it, you take an area and you decimate it. You close its schools, you defund it, you close its hospitals, you board up buildings. It's very hard to get loans to open up a business, and pretty soon the neighborhood is dead, and then the gentrifiers come in and take over the real estate. And I'm sure that that's part of the plan, because Monte is also one of the biggest, it is the biggest real estate owner in the Bronx. And there's certainly, everywhere you go, you see Montefiore posters. I wish they didn't have cameras, so I shouldn't say what I'd like to do to the posters. but you know, it's very frustrating to see all the money they spend on PR and how little they spend on our patients and on taking care of the staff and educating our staff. Right now, we have a whole new batch of nurses coming in who, because of COVID, have not really been able to have clinical experience in their classrooms. So they really need help to be mentored in the hospitals right now, but we don't have the staff to be able to do that. Meanwhile, the hospital is paying millions of dollars for agency nurses, travel nurses. I don't know if you've heard about them. They make like $5,000, $6,000 a week. Well, they understaff us and obviously pay us a lot less, a lot less. But the biggest problem is that there is a shortage of beds. We have a mental health crisis in our community. We have so many people traumatized, depressed, especially teenagers, teenage girls in particular, suicide attempts, suicidal feelings. The kids have had the hardest time of all. Although they weren't getting as sick as our elders, they certainly were suffering. So this mega system, this Montefiore mega system, if it was really committed to the community, it would put the resources where they belong. And all we can do is continue to fight and continue to stand together. I can assure you that the nurses in the Bronx, the NYSA nurses in the Bronx, stand with our sisters and brothers at Mount Vernon, in the community and in the hospital, to expose this, what I think is criminal activity on the part of Montefiore, and to really help to build vibrant communities both in the Bronx and in Mount Vernon, and areas where we've been so neglected. So thank you, everyone, for doing what you're doing, and we appreciate you, and we'll keep fighting along with you.
Thank you, Judy. Mount Vernon at one time had a quality nurses program where they trained the nurses, and in the middle of all of this, Monty got rid of the program, where nurses and doctors were trained here at Mount Vernon Hospital, and once again did it to dismantle us, and because they thought we would give up the fight by now, but here we are still fighting. I'm going to ask our very own mayor, Mayor Shawn Patterson Howard, to come and give comments at this time. And Delia, I'm going to ask you to go, wherever you want to go.
So in October, I believe it was October of 2019, we started receiving phone calls and information from the nurses at Monty, letting us know. At that time, it was Councilwoman Farquharson was a councilwoman. I was campaigning. I had won the primary. You know, we immediately put out a call to the other electeds. I wasn't elected at that time. Called Monty, sat down and met with them. I believe Councilwoman Farquharson had put a post on Facebook, and we began to let Monty know at that time, absolutely not. It was not about a campaign issue, it was about a health issue. And health is not about politics, health is about our rights as human beings. Mount Vernon is the blackest and brownest community north of the Mason-Dixon line and in the top 5 in the nation. And that has been one of my rallying cries. If we've talked about equity, 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 equity all across this country, it sounds like a good word until you're forced to make sure that equity is a reality. And that's been the conversation that we have constantly been having with our electeds here in the state of New York. Since all of this has happened, I believe Monty was scheduled to close in June of 2020. They didn't close, but clearly, you know, the services were not there. The things that we started asking for in October of 2019 was for them to do a zip code study, because the first thing they said is, well, no one in Mount Vernon uses Montefiore Hospital, no one in Mount Vernon uses Montefiore Hospital. Mount Vernon doesn't have enough covered insurance heads to support a hospital, and that's why we can't do it. You just saw in the PowerPoint presentation that that is a lie. What we have also been asking for from day one of this is for Monty to provide us with a zip code study. Prove to us, show to us who is going from 105, 50, 2, and 3 to St. Joseph's, to New Rochelle, to Monty Moses, to White Plains Hospital. And, you know, we could even get that information from Lawrence Hospital, but all of the Montefiore hospital networks. Provide us with that report. Because if your hospital system, because we're not just talking about Montefiore Hospital, Mount Vernon, we're talking about the Montefiore healthcare system. They continue to talk about the regionalization of healthcare. And so in the regionalization of healthcare, it has been Mount Vernon that has continued to help support those other hospitals, New Rochelle or Sound Shore, whatever you want to call it, St. Joseph's in Yonkers, St. John's in Yonkers, White Plains Hospital, Montefiore Moses in the Bronx. It is our Mount Vernon residents that have been supporting those hospitals with our insurance. We're not going into those hospitals without insurance. I had a $250,000 worth of knee surgery in White Plains Hospital. Of course, it wasn't available here in Mount Vernon. Talking about understanding the quality and the lack of quality of health care. One of the reasons I was fired from the city of Mount Vernon, and it's still on my Facebook page, you can go back and find it, is in November of 2016, I wrote a post as I had taken my mother to Mount Vernon Hospital because she had fell and fractured her back in 3 places. A woman with MS and a polio and cancer survivor who had been a 30-year-plus employee at Montefiore Department of Social Medicine and Epidemiology in the Bronx. And as she sat in Montefiore's hospital waiting room, an emergency room in Mount Vernon, they treated her, they said, oh, is she medication seeking? She's medication seeking. She can't be hurt. They had MRI and X-ray machines that were old and broken. And so they never detected through all of the scans that she had fractured her back in 3 places. We had to call our own ambulance to transport her back to her home in pain. She was so frustrated and disgusted, she didn't even want to go down to Montefiore in the Bronx. The next morning, I said, Mom, you have to do something. We didn't know it was a fracture, but we just knew she was in the pain that no one should ever be in, the type of pain that could cause you to have a stroke. And it was the next day that I convinced her, and we called an ambulance, and we called Empress and said, do not take us back to Mount Vernon Hospital, take us to the Bronx. And we called her friends in Monty Bronx ER and said she was coming. And what we knew is what they had proved. They did the scans. Her back was fractured in 3 places. My mother spent the next 6 months in Montefiore Bronx, the Wartburg, going back to Montefiore Bronx, the Wartburg, because not only did she have the fractures, but because she has blood clots, being incapacitated, and the way she was incapacitated, the blood clots were happening. Being a fourth stage kidney disease sufferer, they couldn't break up the blood clots with traditional medication. So when we talk about the importance of medicine, the importance of comprehensive health care, my mother is a case study in herself. And I put it on my Facebook page. I said, Montefiore Bronx rocks, Montefiore Mount Vernon kick rocks. And then I began to explain what happened and got over 100 comments. And I worked for the city at that time, and the Montefiore administrators called the mayor at that time and told the mayor to tell me to take it down. And I said, y'all could all kiss my, and I won't say it, but ampersand, $sign, right? And that's what I said. Less than a month later, I was gone. We have been fighting this fight since the beginning. In COVID, testing wasn't available. It was the Mount Vernon Neighborhood Health Center that we had to work with our state assembly and Senate members to get a testing site at the Neighborhood Health Center. The first vaccination center, again, vaccines at a time where the blackest and brownest community in the state of New York was in need, had to be delivered through our faith-based organizations as well as our neighborhood health center. The hospital came on later, but I'm telling you, they cannot say that they gave the number of tests or vaccinations that were given through the health center. They're the hospital. The ICU closed down. Dorothea Harper School of Nursing closed and transferred to the Bronx. And even when the School of Nursing was open, many of those nurses were giving their practicals in New Rochelle. Our residency program closed. We didn't sit by idly. We fought this. Decisions had already been made. Yes, I met with Dr. Oswa, and several of us met with him. We had Zoom meetings, we had face-to-face meetings. He said so much of this was in play before I got here, I can't stop it. They had planned on even transferring the Department of Corrections inpatient hospital jail, which is, I believe, over a $25 million contract. Our residency program, we received millions of dollars. Our nursing, for the work that they did, received millions of dollars. Before it was Montefiore, it was Sound Shore, or it was taken over by Sound Shore. All of our revenue generating and very important services had been transferred over to New Rochelle. We said all the way back in October, and have said it since then, regionalization of healthcare is one thing, but if you close Mount Vernon, if you continue to strip us of our services, it's going to impact every single hospital in this region. And we can tell you the wait times at Lawrence Hospital have gone up. People have started to complain about the quality of services at Lawrence Hospital is not the same because they cannot handle New Rochelle, White Plains, St. Joseph's, which I sat on the board of St. Joseph's Hospital when I worked in Yonkers, so I know that they're financially challenged as well. We cannot continue, like you said, they're poverty pimps. And they have continued to take money meant for poor people in black and brown communities and use it to fund their already well-funded, well-served, comprehensive hospitals. And so, yes, there is a Senate bill in the New York State Senate right now that we've been working with our Assemblyman Pretlow, even though he's in the other house, and with our Senator Alessandra Biaggi and Senator Jamal Bailey, Senate Bill 3131A, that says that you cannot close hospitals and shut down maternity wards. We continue to demand of the governor and the State Department of Health that if Montefiore chooses to get up and move, then what they need to do is leave our certificate or our license of operation and authority, because that is the prize. Montefiore staying here is not necessarily the prize, but if they choose to leave, they cannot take our Medicare money with them, and they cannot take our certificate of operations. They're not giving those out again. And just so you can understand the importance of that certificate of operation, it is a license to operate a hospital within that jurisdiction. And it is the only one that exists for Mount Vernon. And Montefiore has wanted to transfer it to New Rochelle, to Sound Shore, to Monte Sound Shore. And if they're allowed to do that, then there is no other hospital that we could even recruit to come and take over the hospital here in Mount Vernon or build another hospital, because there is no certificate of operations and authority. And so that cannot happen. I don't always come out publicly and say everything that we're doing, but I promise you we're working behind the scenes. But the thing that we have to do here in Mount Vernon is we have to work together. We have to work together. There are some people that are going to stand on the front lines and shoot, and there's other people that's going to work behind the scenes, but the bottom line is we have to work together. As Cynthia Turnquest Jones says, you cannot divide, you can't conquer what you can't divide. And one of the things is New York State has not always given us first consideration, and so sometimes you have to go outside of your state to get a little bit of muscle, to bring that muscle back to the state and push them. And so what we have done is we've met with Xavier Becerra, who was the Secretary of Health and Human Services, met with him a month ago in DC, met 2 weeks ago with Vivek Murthy, who was the Surgeon General in Nevada. I sit now as the Equity Chair, and I sit on the United States Conference of Mayors as the Equity Chair and the Vice Chair of the Division of Youth, Health, and Human Services. You know, I thought they were going to put me on the Public Safety Committee, and when they put me on that one, I said, oh, how did that happen? And I said, okay, God, Health and Human Services, that's about hospitals, that's about youth. That's what we need in our community. And so I am trying to use whatever positions and influence that I can gain inside the state and outside the state to bring pressure. But the one thing I want to say to us as Mount Vernonites and those who are supporting this hospital, if we are fighting against each other, no one's going to come and help us. They want to come where there is a unified voice, where there is a unified aim, and there is a unified goal. And that is the one thing that we have to do. We have to be unified. So the city of Mount Vernon did go out. We were able to work with the coalition to get a grant for a needs assessment. We were scheduled to release the needs assessment about a month ago, but the county released the needs assessment. We did not want our needs assessment to be lost in that. But what we need is we need for everyone. We need foot soldiers to take them to doors. We need people to stay out at supermarkets. We need to go to churches, so the faith-based community to do what they need to do, but we need to get these filled out so that we can determine and we can really show why people aren't going to the hospital and what services people need. Now, we know we need a trauma center. When they talk about the regionalization of healthcare, that's one of the things that we've been talking to them about. Well, Monty, within your regionalization plan, we don't see that you have a trauma center. In your regionalization, we don't see that you have a Black and brown maternal health center. In your regionalization of healthcare, and we had this conversation on the steps of City Hall during one of the last Save and Transform Mount Vernon Hospital rallies, and we talked about what do we need and what do you see as the essential services. And the other conversation that we heard about are our veterans and mental health or behavioral health services. And so yes, we need diabetes, and yes, we need dialysis centers. Like I said, my mother's getting ready to start doing it 3 days a week, right? And she's going to go to DaVita. But we need these services. No, we are not pleased. No, we are not happy, but we are working what we can work in the back end. All of us have a role to play. The question is, will we come together and when we'll sing with one voice to make sure that Mount Vernon gets what it needs? We are not here to sell out. This is not about politics. This is about getting the health care that our community deserves and that our community needs. And so that's what we're doing, and we are glad that people are staying in the fight. Thank you, NISNA. Thank you, Save and Transform Mount Vernon Hospital Coalition, which we've been a part of from the beginning, from its inception. Thank you, Save Mount Vernon. Thank you to our electeds on the city council and the state levels, Assembly and Senate. Thank you, Jeff, and those with the Poor People's Campaign. We have all of these small different movements, but how can we all come together? Like they say, one band, one sound, right? One goal, multiple voices speaking the same thing. That's what we're looking to do. So thank you.
Thank you, Madam Mayor, for those comments. We do have to come together. The coalition is made up of a bunch of different organizations who come together periodically to make sure that we're still moving forward. And we're going to continue to move forward and press forward to make sure that we not only save our hospital, but we transform it. Saving it and leaving it the same is insanity. We have to save it and transform it. At this time, I'm going to ask Delia Farquharson, since she's standing right here. Delia Farquharson, you go right ahead, ma'am.
Okay, thank you. Good evening. So my role this evening is to try to exact from the community so that we can make some progress. And I agree with Judy that we have made some because the hospital remains open. But it's coming up on 3 years since Montefiore announced that they would be closing the only hospital in this community. And it occurs to me that we can all recognize the injustice of that decision. We have heard the platitudes for years. We have heard the empty promises for years. And this is not about us not working together. This is about us honestly looking at what this community needs, which is a hospital that's properly funded, that is properly equipped, that does not unnecessarily cause the death of our residents, because the numbers don't lie. The numbers really don't lie. We can look at the death rates, and we saw it during COVID. All of us in this room knows at least one person that perished from COVID that might have been saved had we the proper facilities here. And so my question to you as a community is, what are you willing to do at this point to force the hand of Montefiore? Do you deserve a properly funded hospital? Do you deserve it? We've been waiting for 3 years for the change. Should it take 3 years when they've spent $272 million in White Plains? Should it take 3 years for us to get the equipment that we need for the ICU to be reopened? Should that take 3 years? And so that's my question to all of you. Is what are you willing to do and what do you want to see happen? Let us create the intention of what we want in this community, what we deserve in this community. I'm going to tell you, and there's nothing more liberating than not running for office. There's nothing more liberating than that. So I'm going to tell you that I witnessed Senator Chuck Schumer, the Speaker, the leader of the Senate, he came to this community. He gathered people under the awning of the hospital to take photographs. And then nothing happened. And then nothing happened. We have heard our electeds talk about our hospital and talk about what they are going to do or what they want to do. At this point, it is a concrete question of how will you demonstrate your support for the fact that this community needs and deserves a hospital, and we need a plan to be developed. So I see Assemblyman Pretlow is here. And Assemblyman Pretlow, I know, can answer or help us to answer the question of where's the money? Like where's the beef? Where's the money? What has happened to the money? Where has it gone? Do we need to order forensics? The governor, the new governor, has been here. And she has not spoken to this issue. She needs to speak to that issue. And I'm going to tell you that I will not be voting for anyone who does not speak to this issue and develop a plan that says how Mount Vernon Hospital is going to be restored. And I will champion that cause because it is important for our community. So when we think about the chronic illnesses, the diabetes, the heart conditions, the asthma, right? The COPD, what do we need? So I need you to tell me, what do we need in a hospital here? I have developed a list, but I'd like to hear from you. What do you want to see in your hospital, and how will we come together to grow this movement, to grow this coalition, so that we will no longer be satisfied with the platitudes. But we will see that, as Steve Harvey says, inch by inch, everything is a cinch, that we will see the steps that are being taken to restore this hospital. So let me hear from you. What do you want to see in your hospital?
How's everybody doing?
Good.
My name is Jonathan Davis. I'm a resident of Mount Vernon for the last 5 years. But more importantly, I'm a lifelong political activist. Starting in high school, Lieutenant Information of the Black Panther Party in Lang City, New Jersey. In college in Detroit, Wayne State, Fruit of Islam. In law school, National Conference of Black Lawyers. I've traveled to the West Bank and the Gaza Strip, Belfast. But the most important work that you can do is that work right where you live. First of all, I'd like to commend everybody that took time to come out tonight. I was at that meeting in October 19. And that time seemed like it was a done deal. Mount Vernon Hospital was going to close. But it's not closed. But it is closed-ish. Okay? Every community has a right to health care. And we have to look at ourselves and say, what do we have to do? We need to redouble, triple, quadruple ourselves to make sure that we're speaking up. I can stand here and testify that the power of the people is one that can make changes.
That's right.
I lived in Lang City back in the 80s in the middle of the anti-apartheid movement when a casino named Sun City was going to come to Atlantic City and build a casino. At that time, they had a $300 million project. And everybody said the same thing. This multi-million-dollar company, you can't stop them. Well, we did. And there was no South African casino in Lang City. I worked on a political act, like the New York 8. These are political activists who were charged facing 100 and something years in action related to the Brinks expropriation. Everybody thought they were going to jail. They didn't. Why? Because of the organizing. The power of the people is immeasurable, and we can't underestimate our power. You have a basic right to health care. I'm one of the persons, I just used Mount Vernon Hospital 2 weeks ago to get an x-ray. I'm still waiting for my doctor to get the results. So while they are open, they aren't providing us with adequate services. I got criticized myself in that I haven't been doing enough on this issue to bring it to the fore. But I'm dedicating myself to doing some positive things to make a change and to do whatever's necessary to open up Mount Vernon Hospital for the community. Thank you.
And that is certainly what we need in the efforts that we need to move forward. I remember that during this fight, it was Mayor Patterson Howard, I think County Legislator Tubiolo, and other members of the coalition. We drove to New York City to deliver a letter to Governor Cuomo at the time, demanding that he looks into what's happening at Mount Vernon Hospital, and he refused to see us. Matter of fact, he said the only way he'd take our letter if we FedEx it to him, and thank God there was a FedEx store right across the street, and we FedExed that letter that day to him, and he has yet to respond to that letter. So it may be time to write another letter to Albany and see if this governor will answer that letter, and see if they will come. As we talk about, and Delia has talked about data, if you try to get controversial data from Monty, they will not give it to you. Simple question. Monty, how many people have been transferred from Mount Vernon Hospital that have died? They will not give you that information. How much money of the CARES Act have you spent in Mount Vernon Hospital? They will not answer that question. Sometimes they tell you they don't have the data, which is impossible. They have it, they just don't want to share it because it will disparage them as it should, and it should shame them as it should. And so we continue this fight. As Judy was saying, they had a job fair today, which I think is funny because every time we get ready to have a rally or a town hall meeting, they do something. You know, Dr. Oswald will say, oh, we're going to hire some people. And so they have a job fair, but then they send the people they hire to New Rochelle and to the Bronx. It is amazing what they do to make sure that they say, oh, we had a job fair, and then they'll say nobody they applied to Mount Vernon because you sent them to the Bronx and New Rochelle. So we continue this fight. Jeff, you're standing there, and so you were next anyway.
Okay, well, thank you, Reverend, thank you. I really I wanted to affirm and follow on the energy of Baba Davis here because, you know, he said something in terms of the power of the people, and it inspired me to remember really that a lot of the things that have been said already I was considering before coming to the mic, but everyone said something, even the mayor had listed veteran services as something that a particular demand in services that I will expound on. In fact, it's the one thing I want to speak more personally on. But it goes to the issue of demands, and it goes to the issue of qualifying for ourselves, legitimizing and validating what healthcare looks like to us. I don't think, frankly, 2020, the pandemic, even the Black Lives Matter movement before that, has pretty much erased for me and most people any sense of what we feel is necessary collaboration with the system that causes our problems. The time for begging is over. All right, we've been pretty much, and by we I mean most marginalized groups, certainly African and Native groups in this country, have been beaten literally to death in this country since the 60s to be conditioned not to resist, right. To be told that it's not okay to be radical. And yet we live in the most radically inhumane system in the world, and yet it profits off of us, literally by the trillions. And in that sense, I think we need to look at the hospital as an opportunity to redefine what healthcare should look like. Montefiore is not healthcare, it's health profit. It's sick care, actually. Mm-hmm. So in the sense that we should continue to demand the hospital and care for preventative maintenance of our health, we should look for the traditional senses of what our civilizations have taught us about care for humanity. And it comes from the earth, it comes from nutrition, it comes from psychosocial elements of humanity, right? It's not pills, it's not surgery, unless obviously it's necessary. But these are the elements of capitalism that's made healthcare what it is. And it's one of the reasons we're sick, on top of racism, materialism, et cetera, pollution, et cetera. So I want to speak to that in terms of how we redefine what the hospital and its services look like. We should look at things like nutritional, holistic care that they need to make space for if they don't have it already. Veteran services is something that, personally, is something that afflicts me. As a Navy veteran of this country, I spent many years following my active duty service, serving with the Veterans Administration, understanding how deeply one has to struggle as a veteran just to get the services that you are legally allowed to have. You got to struggle with social workers and team leaders in the VA system against the VA system. The VA system didn't even want to identify PTSD in the early 90s until enough men were coming home with it from as far back as World War I. And now today we have increasing amounts of PTSD. We have women, now that they are a more significant number of the battle force, they are coming home with not just PTSD, they're coming home with sexual assault, rape, and other kinds of gender-based violence inflicted upon them by their own member comrades, which is a whole other conversation. But when they come here, the VA does not serve them. Veterans are at least 11 to 20% of the homeless population in this country, and yet veterans care is not a specialized service in the hospital. It should be. It should be a laser focus in the black community that the veterans that come home get special services as acutely and as widespread as they can get in this hospital. If we don't demand that, we're really wasting our time. We're taking for granted our role in this world and in this system. So I'd like to leave us with that thought. Thank you.
Thank you, Jeff. I'm going to ask at this time that, sure.
So the question was asked by Ms. Farquharson, what steps we officially want to take. So on December 28th, 2021, Governor Hochul signed a new law that will require New York hospitals to assess community impact of closures and mergers. And it says it is the Health Equity Assessment Act, which advocates say will help address the impact of decades of hospital closures and consolidations across the state, which left certain communities, primarily low income and neighborhoods of color, underserved when it comes to health facilities. So I think one of the first things that we should do is ask the governor and the state commissioner of health to do the first assessment on Montefiore, Mount Vernon. This is the bill that the governor signed. This is a bill that says, this is perfect. Sometimes the way, accountabilities, this is what you said. Absolutely. So let's let Montefiore, Mount Vernon be one of the first assessments that we do, as it is the blackest and brownest community in the state, which is disproportionately impacted by the selling off and giving away of our services and the redirecting of our patients to other places to prove their point. So that's one thing I'd ask.
So the action then, Mayor, is that you will write the letter to the governor on behalf of the community?
I've already just sent this to their office.
Okay,
Very
thank you.
good. And that's a great start, because
There's somebody who wants to speak.
it makes all the difference in the world that we hold people accountable to their words and to their actions. Yes, ma'am.
Good night. My name is Melissa Mede. Okay, for me, the first step, I don't know if it starts already, but the first step could be a community petition. Starting in the community, also nationwide. Reach out to the community, we can start signing, have signatures, whether it be via computer, it doesn't matter. As long as we get in the signature and sending out the signatures, the Monty, the head of Monty, the governor, the state, whichever way, but start with a petition. Hear the voice of the people. We are the people. We need the hospital in the community. Once the people comes together, then basically you can understand that we do need the hospital. It is important to us. And as we stand together, the mayor said, together we can. But if we don't come together, we'll fall apart. For me, the first step, a petition, community voice. Together we will.
Thank you. We have certainly petitioned before, and we can certainly petition again. One of the things I ask all of you to do is to join our coalition. This is where we come up with the ideas and how we move forward to make sure that we're moving together as a community. And once again, this is one of the first of many times that we're going to keep calling the community together, because as we've heard today, there's power in the people. And so as we come together, we are going to continue to make sure that we fight together. It is good to see our comptroller here, the Reverend Dr. Darren Morton.
Unfortunately, I don't have no money for a hospital. But thank you. So I don't necessarily talk much unless I think I have something that is going to be of value, or at least for us to think about as to how we do this. Councilwoman Farkas had asked a question, and she's asked, well, what do you want in a hospital? And I think that that's probably a very important question for our community. Because by the behavior of our community, it suggests that we don't know. It suggests that we don't necessarily, and this is massive, right? Not individually, but massively, that we don't understand the importance of a hospital being within the city. And so the question really is, on top of that, is how do we get our community to understand the value of a hospital in their community? Right? Because once people believe something is of value and it's important to them, they fight for it. We as a people, historically, culturally, we fight for the things that we believe truly are of essence to us, right? And we may have failed in that aspect of getting people to understand the importance of having a hospital here. And I say that because I do that internally, right? I'm sitting there and I'm listening and I'm saying to myself, well, Darren, have you really even thought about how really important this really is? And maybe it's because, we get caught up in the fact that we have other means. And so, yeah, I can travel and do something and get it. But what about my brother and my sister who cannot do that?
Yeah.
So as I'm reflecting on your question, I started to say to myself, what I would like to see in a hospital in Mount Vernon is basically what Jeff actually said, right? Is that we transform our perspective around wellness, and that it meets those needs, right? Because we have elderly people here that we need to make sure that there's geriatric care that is happening, right? We've got young people that don't understand how to even read a label on a food packet to understand what's healthy and what's not, right? So that they may not need to actually end up having the maintenance of care, right? We definitely need to have a birth center. Yes. Having a birth center helps to bring life and family and understanding, because if you're born there and people are there, then it draws people there to know that if my child can be born there, then I can go there to get my operation, to get my heart taken care of, right? Take my mother, and to be able to get cared for. So I think there has to be a birth center, right? We definitely have to have a cardiac center, right? We have to have something that deals with the heart, because we have issues, right, around heart, right? But all of that starts with us being able to at least have some kind of comprehensive, holistic wellness, wellness services in our hospital. And we may be able to get those answers through the survey, right? And here's the thing. So yeah, we have to go places and do surveys, but also now in the spiritual world, most people are doing the whole virtual kind of thing. We got to also get those things on our Zooms and on our Facebooks for people to fill them out right where they're on their phones. Got to make it a whole lot more easier for people to be able to fill it out. So that's my thoughts. I think so. I'll go back. I'll close it with how I started. I think we got to figure out how do we get people to understand the importance of having a hospital in our community.
Thank you.
Thank you, Comptroller. Yes, you were going to come, but it saves me calling you, Assembly Person Pretlow. Good to see you today. Thank you for being
Good evening,
here.
everyone. I've been part of this coalition from the beginning.
Yep.
And I've been trying to do whatever it is humanly possible to get things done. The mayor kind of stole my thunder. I was going to talk about, we do have legislation. I mean, the councilwoman, I said, what can we do? We have to stay in our lane. I'm a legislator. I do laws. I don't implement those laws. And it's interesting that you mentioned the prior governor, whatever his name was, wouldn't even meet with you. He wouldn't meet with you. And everything that we're talking about this evening is in the hands of the Commissioner of Health. And that person reports to the governor. So if the governor isn't interested, the Commissioner of Health isn't going to override that governor. I have a meeting scheduled with the new governor, who has been quite receptive on a number of issues, in 3 weeks. I believe at the coalition meeting prior to the one we had last week, I had asked for information as to what I can present to them to foster our case, because we do have a case. I mean, I'll share a personal experience. I mean, the gentleman said it's close-ish. No, it's closed. And they treat this hospital like a garbage transfer station. You go in, you sit around, I give it a personal experience, so don't share this with the world, everybody. The mayor's kind of aware of it. You know, a good friend of mine passed away a couple of months ago of a heart attack. You all know who he is. I was in my office at 11 o'clock in the morning, and I felt a kind of a weird feeling in my chest. So I said, let me just go to the hospital and let them check it out, do a quick EKG, make sure that everything is all right. It's 11 o'clock. My staff person drove me there. They saw me within 10 minutes. I had the EKG, and then they said, well, we want to monitor you for a while. And they monitored me, and they said, oh, we want to admit you. An ambulance came for me at 4 o'clock. 5 hours later, so I sat in the emergency room in Mount Vernon Hospital for 5 hours. They ambulanced me to Moses, where I was in the emergency waiting to get room until 3 o'clock in the morning. 3 o'clock. They admitted me. They so quickly couldn't find a bed. How you find a bed at 3 o'clock in the morning that you didn't have at 12 o'clock at night? I don't know. And if something was seriously wrong with me, if I really was having a heart issue, I would not be here speaking to you right now. Because that ambulance ride, which took around 20 minutes to get from Mount Vernon to Moses, is the difference between life and death. So I understand what's happening. And they have this fallacy of they have an ICU. There are no doctors there. When the ICU physician's assistant came to talk to me, not that I take anything away from physician's assistants because they're well trained, but they're not doctors. And a few of the nurses, one of them may be in here this evening, told me, ask them this question, because they know what's going on there. And all they're doing is shipping people out. There are hundreds of millions of dollars that the state is giving Montefiore Medical System that's not being spent here. They have been using our demographics forever.
Yep.
Since they've been there. And prior to them, Sound Shore did the exact same thing. And they take the money and they put it someplace else, and there's no oversight there. That oversight is in the hands of the Commissioner of Health. And if he or she is not paying attention and things fall by the wayside. We all know that Monty has a whole lot of money that they spend anywhere they want to spend it. They would rather hang posters up in Mount Vernon talking about job fair and what a great hospital it is, but they won't put a dime in this hospital.
Yep.
We had at Mount Vernon Hospital several years ago a hyperbolic chamber, which was used for treatment of burns. World class.
Yep.
World class. It's not there anymore. What do we go to the hospital now? What we see is guys in green suits with numbers on their chest. That's not what the hospital's supposed to be about, but that's what's keeping them here now. If they didn't have that, the hospital would more than likely be closed now. So I'm asking whoever has the power or the information that I need to share with the governor, not the commissioner, I want to share this with the governor. Please get it to me as soon as possible. And another thing that we have to fight in this city is apathy.
Yep.
I sent out not 1, not 3, not 5, not 9, 10,000 emails about this meeting tonight. 10,000. And I'm glad that the people here came, but there should be, this place should be overflowing.
Yep.
But when you have people that don't really respect the hospital until they need it,
Yep.
this is what you get. So I'm just saying, we're going to keep up the fight. I'm going to keep doing, what it is that I'm doing, and anywhere I can be helpful to the nurses who have been stalwart in this. They have really, been fighting the good fight. Julia and her whole crew is just doing a fantastic job, and this is a winnable fight.
Absolutely.
This is a totally winnable fight. Thank you.
Thank you. Assemblyman Pretlow, you mean to tell me you left a hospital that had open beds to go sit in a hallway in another hospital?
Yes.
Yeah.
I was in the hallway, as a matter of fact, for a while, before they put me to this huge waiting area, wherever it is, have a little private cubicle, and they finally admitted me around 4 o'clock. Then they woke me up at 6 for more tests, and then I was out of there 11 o'clock the next day, and it was all about nothing.
But the hospital you left had open beds, but no doctors.
Floors.
Open floors and no hospital. We'll get you the information that you need. We'll talk about that information you need. But I suggest you already have everything you need in that story you told. Yes. If the governor doesn't feel that, no matter amount of data we give you, is going to change your position. Because that's a real life situation. That is criminal. It's criminal to be able to say you may have a heart problem, so we're just going to send you on a 20-minute bumpy ride to another place. And we're glad to see you today, and glad that it wasn't not any more serious than it was. We do have a representative from New York Department of Health here, and I'm sure she's taking copious notes and will share those notes. Celeste Johnson is here, and so I'm sure she's taking copious notes and will share that notes. And we ask that you let the health commissioner know we would love for them to come and have conversation with us in Mount Vernon, because we, as you can see, we're serious about saving our hospital. We're not going to allow them to transfer our certificate of need to anybody else. We want a hospital, we deserve a hospital, we demand a hospital, and we're going to have quality health care in the city of Mount Vernon with the help of all of our electeds. We're going to do what we need to do, and with the help of the citizens, because your voice is going to matter the most. Madam Mayor can have 1 million conversations, but when she has 75,000 residents behind her, that conversation becomes more important. And so we need to make sure that we continue to do what we need to do to save and transform our hospital. I see our county legislator, David Tubiolo's here. I don't know if you want to speak or just wave at us, but I know he is here. I want to recognize our electeds.
Thank you, Pastor. Hi, everyone. How's it going? I'm fully behind this. We've been fighting for quite some time, and Mount Vernon needs a hospital. It's extremely important for our healthcare and our community, and that's just hands down. So whatever I could do to be helpful, I'm going to keep helping communicate, keep helping fighting, and keep help organizing, and I'm here to listen. So thank you for having me.
Thank you. We appreciate that. Do we have anybody else that wants to share tonight? I know Congressman Bowman was trying to make his way here. He has not made it yet. But we want to be able, I see our Councilwoman Gleason is here. I don't know if she wants to share tonight, but we want to give her opportunity to share.
My perspective was a little bit different from the very beginning. I think Councilwoman Farquharson could understand. I was angry that the community did not use the hospital. And it was so unfortunate because we needed this hospital. I come from a family, my father would not let me take him to any other hospital except Mount Vernon Hospital. I didn't understand it. I said, Dad, I don't know. And he's like, just take me to Mount Vernon Hospital. There was the best care at Mount Vernon Hospital. We have the best first responders there, the best nurses, the best doctors, the best janitors, the best people you could possibly have in hospital. I'm angry at New York State for not investing in it. I went in there in 2008. My mother had just passed away. My father took a bad fall, and we went into the emergency room. Going into the bathroom, walking around, and I never forget my father telling me, you know what? Montefiore's taking over this hospital. He's like, but they don't want us. They wanted New Rochelle. Everybody knows that story. Yeah. That we were just a byproduct of that sale. And ever since then, we've gotten nothing for it. We need it the most. I remember a time, my husband was a police officer, my brother was a police officer here in Mount Vernon, my father was the fire commissioner. I remember Mount Vernon Hospital being a trauma center. Okay, I remember that Southern Westchester communities came to Mount Vernon Hospital because we had the best of the best. We have to just infuse this into this community. We know now, we really do. After the pandemic, after the unfortunate death of Kayla Green, we understand the importance of this hospital being in this community. How do you bring in a ship that was never used, basically never used, okay, on the west side, and not use the hospital here in Mount Vernon? And I want to compliment you guys for really breaking this down tonight, because I didn't have a very good understanding of the funding. And that's what I had said to you from the very beginning. How do we sustain this hospital? How do we sustain it? The best part about Mount Vernon is that when people try to take something away from us, we fight to keep it. So we just have to keep going out to the community. Over the past year, walking this community, the most unfortunate story I heard, I walked into one of the senior buildings and having a conversation with one of the seniors, and she asked me about the hospital, and she said, I had the worst experience. And I said, well, what was your experience? Exactly what Pastor Pogue said. Here's a woman who was taken 3 blocks to Mount Vernon Hospital with COVID, deathly ill, shipped down to Montefiore in the Bronx, and had no way home. She had no wallet. She had nothing on her. No way home. No way to get home. That's ridiculous when she was 3 blocks away from a hospital that should be functioning 100%. So I am 100% behind you guys. I didn't really have a very good understanding at the beginning because, like I said, I was angry that people didn't use the hospital that, I grew up in. I mean, every broken bone came out of, the emergency room here. And I thank you for keeping up the fight, and we'll all be behind you, whatever you guys need us to do as elected officials. So thank you, guys.
Thank you. And just to understand that this is systematic with Monty. If we remove the services, then people won't use the hospital. If people won't use the hospital, we can say there's no need for the hospital. But then the people in Mount Vernon are going to other hospitals, which they won't give us data how many people come from our zip code going to other hospitals, because it'll show our need for the hospital. And so even when we talk about COVID care, here's the crazy thing about Monty and what they did. When they transferred all the COVID, there was 2 rounds of CARES money. There was 2 rounds. First round, Mount Vernon got $21 million. There was another round of funding that we got $0. You know why? Because they transferred all of our COVID patients out. And because they transferred all of our COVID patients out, it seemed like we didn't have cases when we had some of the highest cases in the county. So it was ridiculous that they still didn't get any CARES money for that second round, because they transferred all of our patients out. So it is ridiculous what Monty does.
Pastor Polk, I think it bears repeating what Judy Gonzalez said, and that is that, and it's not conspiracy, it is that there is intention behind
Absolutely.
what's happening, right? And it is for us to recognize that this is intentional, to call it out, and to not allow it to happen. Because I guarantee you that when the community resources are depleted and the property is sold for 50 cents on the dollar, then we will see a restored community and a better hospital. But we deserve that now.
Right.
So we should not allow that to happen.
272 million.
Absolutely, for one
Could
hospital.
you imagine what that would have done for Mount Vernon Hospital?
Half of it.
Half of that.
Half of it. Yes, ma'am.
Right now, we have, what is it, almost $50 million in the Medical Reinvestment Act money. If they would just have put that money in the hospital.
Right.
You asked what a good hospital would look like in our community. A good hospital in our community, a holistic hospital, prevention, intervention, and restorative health services, if we just go back and look at what they proposed in October of 2019 and talked about all of the mental wellness and the prevention services that they were going to provide on Sanford Boulevard, if you're able to provide all of that prevention, that intervention, and restorative health services on Sanford Boulevard, why are they not being provided in the current hospital, which has a much bigger footprint? So if you knew that is what our community needed and deserved on Sanford Boulevard without inpatient or behavioral health services or dialysis services, then you clearly know and understand that the same services, the vast list of services that they listed for that facility on Sanford Boulevard is needed in the current hospital.
Absolutely.
And we have the space. There are empty wards. The School of Nursing has been closed, so we could even expand the services. New York State even knows the importance of what Mount Vernon needs. And you know why I know that? Because there is a $12 million grant that they're investing in the Mount Vernon Neighborhood Health Center that we just finally, after many years, transferred the ownership of the property over to the health center so they could
Great.
show site control. So if the state would invest $12 million in our federally qualified health center, then they should multiply that by much to invest the same thing. So like we said, the assessment is digital. It is going to be on, I believe it's on our social media pages and on our website. We are asking for all of the clergy, all of the organizations to do everything to blast it out. And then if we need to have paper copies or iPads or whatever to walk around and help other people who might not be as digitally strong in doing that and might be intimidated by that, then we can do that. So, you know, we absolutely know what we need. And the assessment, once again, will give us the data from the community saying why they have not used it and what they would like to see. So, thank you.
And let me ask an even a bigger question as we talk about the services that we're going to go into the Sanford Boulevard site. Monty had a $42 million transformation grant to do that building. So why didn't they take the $42 million and put it in the hospital? It was matching funds anyway. They were going to have to spend it to get it. And so they were going to have to use that money anyway, so they had the money. And by all means, we want to partner making sure that we do this health survey to make sure that we understand that and make sure that we partner with the mayor's office to make sure that that information, once all collected, gets out and we can see how we put it together to make sure we move forward with that great information, that data that says this is what our community asks for and this is what our community needs. Listen, we need care from cradle to the grave. Period. That's what we need. Cradle to the grave care is what we need. I see that our congressman from the 16th Congressional District has just walked in. It's good to see you, Congressman Bowman, who's been in this fight even before he was elected. So it's good to see you here, sir. You want to share with us today, sir. You come here, you come there, you come wherever you want to come. We're going to get you a Mount Vernon shirt, sir.
Yes, yes. Listen, I got a bigger district now, so I need
That's
T-shirts
okay.
for every section.
Nothing
of the
bigger
district.
than the maroon and gold, sir.
Yeah, yeah, absolutely, absolutely. So I don't know what I missed, but couple of updates. So I recently met with executives from Montefiore, and we were speaking specifically about a trauma center. I mean, obviously, I think everyone here wants a comprehensive hospital, just a fully functioning, comprehensive hospital. But we were speaking specifically about the trauma center because after the young lady Kayla was killed, that conversation was brought to me by students in your office, actually. So that's where the conversation was. And what they shared a few different things. One of the things they shared was revenue issues with the hospital, because the hospital historically has been underutilized. So we began to discuss potential ways to generate revenue for the hospital. What other services could the hospital provide that will generate revenue? And we were just brainstorming. Mm-hmm. So things like more mental health and behavioral health services that will bring people into the hospital, more relationships between the hospital and the school district, and particularly Mount Vernon High School, and programs that could generate more revenue. Nutritional programs that could, again, more preventative nutritional programs where people come into the hospital, use it for those programs to generate revenue, all in an effort to generate traffic, generate revenue, and hopefully build a trauma center or make it more comprehensive. The state also is a part of this conversation as well, and I'm sure I saw Assemblyman Pretlow here somewhere. There he is. I'm sure he has something to say about that. But the state is a part of this conversation as well from a revenue perspective. I'm not as clear as what that looks like, but that's a part of the conversation. How could the state be a part of generating revenue to expand the hospital and make it more comprehensive and fully functioning? I think we all know also Yonkers also doesn't have a trauma center, and I think Mount Vernon and New Rochelle may have a level 3, but not level 1. So it's a desert of trauma centers in this particular area, and that's why everybody goes to Jacoby or White Plains. So that's what I've got as of just a couple days ago. Mm-hmm. That's recent. I just was on the phone with my my legislative director is going to call me back because I want to see if there's anything we could do through appropriations. You know, it's an annual appropriations process to generate more funds for healthcare across the country, which could support the hospital as well. And the last thing I'll say is the healthcare infrastructure right now is really struggling overall, and needs massive influx of revenue, a lot of corruption from insurance companies and pharmaceutical companies and other companies. We just need to rebuild our healthcare infrastructure across the country, just in general. So those are a couple things I got right now.
Yeah, I think one of the things is next time you have a conversation with Monty about Mount Vernon Hospital, just tell them we want services. Mm-hmm. Any will be nice.
Yeah.
You know,
Yeah.
they don't generate revenue because they don't have services.
Yeah,
And they,
correct.
And they have purposely and systematically taken away the services out of the hospital so they can have that conversation with you and others that says the hospital doesn't generate revenue. Yeah. Well, you can't generate revenue if you don't have services.
Yeah, and just one quick point on that. So they were talking about it also from a historical perspective. So I forget when Montefiore came in, but Montefiore's
took over from Sound Shore,
correct,
and promised that they would put in the necessary funding to bring services back to the hospital so that people can use the hospital, and they failed to do it.
Yeah, personally, I wasn't here for all that.
Absolutely.
But I know how that works. I don't think, personally, I don't want to speak out of turn. I think they were brought in to close it down. Like, so when I came in, when we first met,
right,
that's what was happening, and we fought back to stop that from happening. I personally think they were brought in to close it down or further private, right? So, and that was via Cuomo's request that they were brought in as well. So there's some, I'm giving you what I got in the moment.
Okay. That's a partnership with what is there's a big Long Island hospital health.
Yes, that system to help close it down.
Yeah.
And then if we look at Monty's books, they are profiting very well.
Yeah.
they are not struggling.
One last thing I'll say that they also brought up was something about the books before they got there, not being off. I don't know, but that's what they brought up.
But their bottom line still shows
yeah.
that their
is-
profit margin is great.
Well, this is what I'm saying, right, about
Yeah.
the whole system, right? The
Right.
system it's a for-profit. In my opinion, healthcare is a human right.
Right.
So we should treat healthcare as a human right.
Right.
The way the healthcare system works is it's a for-profit system, and executives at the top of that for-profit system
Absolutely.
make a lot of money.
Monty even loaned one hospital, how much?
18 million.
$18 million.
Yeah.
They loaned the hospital $18 million.
Yeah.
They loaned Einstein $18 million.
Cool.
So if you can loan a hospital $18 million, you can put $18 million in this hospital.
And-
And like you said, we need oversight.
And I think-
Well, yeah.
Yeah.
Yeah, and I would, I'll let you go, but I have one other thing I
Yes,
want to
go
say. No, you can go ahead.
No, I think that the big question is that we have no accountability for the money that Montefiore has been appropriated. We don't know what has happened to the money, right? Money has been given to Montefiore as an entity for Mount Vernon based on our demographics, and we have no sense of how that money has been spent.
Yeah.
And that's what we need.
Yeah.
So we need someone to focus on that, someone of our elected to help us advocate for how do we get an accounting from Montefiore of what has happened to the money and how much money.
Yeah, so what would be really helpful for me is for all of us to get really clear on what our demands are.
Yep.
And then I could just communicate that to Monty.
We would definitely get that to you.
Yeah, that would be helpful to me.
We'll definitely get that to you.
Thank you.
Thank you, Congressman.
Yeah.
I saw a hand in the back first.
That was me, sir.
Yes. Come on to the mic so we can hear you. And we're going to wrap this up in just a few minutes.
To add to what Mr. Pretlow says, that Montefiore is watching, and guys, you're not turning out, and they realize that we are not a cohesive group, and they capitalize on that, and that's why now we are not getting things moving forward. We need to, cousins, brothers, sisters, spread the message all over. We need to come together, because a force is as strong. They cannot manage us if we decide to
Absolutely.
to capitalize on this.
Absolutely.
Mayor, I appreciate what you have done in the initial stages when all that mess was going on. I've been exactly, and I see here tonight. I don't even see my co-workers. I work for them. I don't see. I've seen one person here representing. The friends I have, people who have had bad experience in the hospital, nobody turns out. So what's going to happen tomorrow? They're going to look at us and laugh at us and say, oh, there they
Yep,
goes
and we're going to keep going until we continue to build up community support. And this is, as I said, one of those initial places where we are to start this conversation. So next time we have a conversation, more people will come out and be part of this conversation because we need it. And we can save, we're going to save and transform our hospital because we have the moxie in Mount Vernon to do it. And we're going to do it, and we're not going to allow Monty to take away our health care out of this city.
Thank you.
Yes, ma'am.
I think there's a lot of moving pieces here, and, you know, I've been fighting for healthcare since the takeover of Lincoln Hospital 40 years ago. I don't know if anyone knows about the Young Lords taking over Lincoln Hospital 40 years ago. I'm not saying people should do that now, but to me, there's an inside game, there's an outside game. I have the utmost respect for the mayor who has patience of a saint, pulling every angle that's possible. Jamal doing what he's doing on the federal level, that there's going to be a meeting with the governor. It's an election year. I think we have to do the inside-outside game and pick our soft targets and our hard targets.
Yep.
To me, the soft target is the governor. There's going to be a meeting in 3 weeks. People are exhausted from email and text messages. We need to do door-to-door knocking and phone calls. Everyone goes to church. Well, not everyone. Many people go to church. Many people send their kids to school. We pass around a plate, let's pass around a clipboard with a petition with specific demands. Comprehensive pediatric care, comprehensive maternal child care, a trauma center for our community, mental health care, primary care, beds for people to go in so that families can visit them and people can walk home. Those are the things that we want for this hospital. That's what any community needs and deserves, so that your providers know who you are. And then the hard target, I think, is Montefiore and their Board of Trustees. I think there's nothing wrong with going to the homes or the businesses of the Board of Trustees and letting them know what their endowments are doing. We did, years ago, Montefiore had a fundraiser at the Waldorf Astoria. We all showed up there, and we handed out cards saying, won't you give your check to provide more staff to care for our patients? They were very upset about it, but we made an impact.
Absolutely.
So I think we need, militant activity. And people don't come out because they don't look at their emails. They're exhausted from COVID. People are alienated. I think we now have a little bit of a reprieve, going door to door, going face to face, sending clipboards to schools with our petitions, getting those demands. We know what the demands are.
Absolutely.
And in 3 weeks, when there's a meeting with the governor, if there's thousands of people signing petitions saying what exactly we need, when Jamal goes back and goes where he has to go, maybe put some pressure on Schumer. If we have very specific demands, we have it laid out, people are signing it, a constant ongoing thing, because I'm just afraid that with some time, I don't know what's going to happen.
Right.
I know Montefiore's stuff is thinking, and of course the bigger issue is getting a single payer bill passed, at least in the state or in the federal government, so everybody can get profit out of healthcare. But I think that door to door is the way to go.
And we definitely will take that all in consideration. All of you who have signed you'll get emails from when the coalition is meeting. We do all our meetings via Zoom right now, so you can just sit at home and help us to create everything that we need to create. We ask all of our electeds, if you can't be on the Zoom with us, that you have a representative so that they can take back the information, because it's all going to be important. We got to work together, and we'll get this done. I saw the mayor, then I see you, Jamal.
Just one of the last things. For the past 2 years, as Mount Vernon, as a city, has tried to sit down and put together our emergency disaster plan, it is very difficult to do. Why? Because we do not have a fully functioning hospital. And so if we, in October of 2019, I believe it was Miss Church, she was a doctor, and she sat in that meeting at Grace Baptist Church.
That's right.
She said, Mount Vernon is a ticking health time bomb. She said, if some type of infection or virus happens in New York City, with us being a major transportation hub in this region, Mount Vernon is going to be severely impacted. That was October of 2019. And who knew that by March 8th of 2020, Mount Vernon would see its cases? Who were the first ones that we saw affected? We saw the tests come out of our fire department, because they'd went into a nursing home. The nursing home was not reporting the cases and the sick. They didn't understand what was happening. But when our healthy firefighters came out and 3 days later were sick, we understood and was able to trace back where it was happening. The other thing that we saw, and we talk about, the AG and everyone is investigating, our hospital was empty during COVID.
Yeah, absolutely.
But yet, they sent sick people to our community nursing homes. And that's when we saw the numbers in Mount Vernon explode. We have to do something about it. I don't play a harp, I blow a trumpet. And if Congressman Bowman remembers, when he was elected, before he got sworn in, I think the first meeting we had in the office, I talked to you about our hospital and the importance of the hospital. So the two things to the governor has always been hospital, sewers, and then third, our safety. And so in my conversation, we had a press conference around the gun law, but in my 15 minutes in my office with the lieutenant governor today, we talked about the hospital. And I will be with the governor this weekend for a while, moving around in the area, and trust and believe what she will hear is the hospital. And her people just texted me, and I was like, this is, again, what we need to talk about. Because in early 2020, when she was lieutenant governor, we met, and the conversation was, absolutely, I support the continuation of this hospital. As lieutenant governor, you didn't have much power. As governor, you have a lot of power, and she's been the first responder to abortion. She's been a first responder to gun laws. She's been a first responder to this. And so with her Health Care Equity Assessment Act, the first thing that she needs to do is look at Mount Vernon Hospital.
Congressman.
Yeah, just want to briefly add, the sooner we can get something in writing in
Yep.
terms of a comprehensive set of demands, the better. And I just want to echo the point that was made earlier about universal health care. So there's the New York Health Act
Yep.
that's looking to make healthcare universal across the state. Like, support behind that would be huge in this entire conversation. And obviously, there's the Medicare for All bill that's federal that we're trying to pass as well. So as we have this conversation, let's have that one as well, because it's a really, really important one. And the New York Health Act is not far from passing if it had the right push. So we got to continue to do that as well.
Absolutely.
Yep.
Thank you, Congressman.
Don't mind before you leave, sir. Okay. I would like for you just to remind Mr. Schumer that he stood on the steps of the hospital and he promised us that he'd do everything to keep this hospital open. Just don't forget that Sunday when he came here.
And please remember that we haven't heard not one time anything from Senator Gillibrand. She has not visited Mount Vernon on any occasion for any reason since I've been in office. So we need to remember that too.
I see one more hand, and then we're going to close out. Come on, yep.
No.
Come to the mic so we can all hear you.
Hi, I just want to thank the coalition, and I'm grateful to hear that you did stop what was going on with the hospital. I did volunteer when they had the time, when they had the cards and stuff. But I had a relative that actually fell out near the bus stop, and thank God he was able to go to Mount Vernon Hospital. But what I think we need is that everything that every other hospital have. Mm-hmm. Why can't we get everything the other hospitals have? And redlining is embedded in the system. Redlining is when they redline communities where the funding can't come in.
Yep.
The zip codes, they know what they're doing, they know where we're located. So the mayor said, they don't want to, tell us what's going on. And that's all over the world. If you can even go online and see redlining in all the communities. It's horrible. It's horrible. So it's embedded in the system. And like, I'm part of a church, and I'm pretty sure you know I am. Anything we can do in the church, maybe we do a petition, maybe
Absolutely.
afterward, or we, even all the other churches, everyone, even the schools or whatever you want me to do in regards to having a petition and maybe something after the church or, or whatever.
Definitely.
I would like to be a part of this collation and,
Thank you.
And, thank you.
I want to thank everybody for coming out tonight. Like I said, this is our first of many. We're going to plan some more, so get ready to bring more and more people out. I hear we need petitioning, so the coalition will be working on petitioning and getting that together very soon. Please look out for the email for our next meeting, which will be coming up shortly as we plan our next meeting, because we're going to need all of you. Every voice is important. We're not a coalition where nobody has a voice. Everybody has a voice on the coalition. We need to hear from everybody, not just our organizations. We need to hear from individuals because that's where we're going to get the push to do what all of our elected said they needed us to do, right? So they'll get in the room, but they bringing us with them. I'll say that again. They're going to get in the room, but when they're in the room, they're bringing all of us with them as they speak for us collectively. And I believe that all of these that have been in the fight from the very beginning, the mayor didn't come on once he got elected, congressman didn't come on once he got elected, they had been in the fight before their elections. And so I believe they'll continue this fight and continue to make sure that we transform Mount Vernon Hospital. So thank you very much. They want to take a picture, so if everybody just stay where they are, we'll come that way. Are you going to take a picture this way? Yeah, with everybody.